Our goal at Resuscitation International is to provide a portable, simple, reliable, and affordable solution for CPR to help improve patient outcomes. ROSC-U's simple design makes it easy for healthcare professionals to use ROSC-U when responding to patients experiencing a sudden cardiac arrest. In this section, we will examine ROSC-U's basic components, as well as general requirements associated with its use. ROSC-U is intended for use on adults 18 or over, with a chest circumference of 30.7 to 51.1 inches. ROSC-U must only be used in cases where manual CPR would normally be initiated, and in such cases, manual CPR should be started immediately, prior to the application of ROSC-U. Additionally, during the operation of ROSC-U, personnel certified in manual CPR must always be present. ROSC-U should not be used if there is no indication that chest compressions are likely to help the patient, if it is not possible to properly position ROSC-U safely or correctly on the patient's chest, if the patient is under 18 years of age, or if the patient is pregnant or has a traumatic injury. Please be aware that you should always consult local protocols for the proper integration of mechanical chest compressions into your sudden cardiac arrest protocol. ROSC-U consists of 4 basic, easy-to-use components: a battery control unit, compressor, torso restraint, and head stabilizer. The battery control unit contains an integral battery, main power rocker switch, charging port with the provided charging port cover, function control panel, and a Molex connector that links the battery control unit to the compressor via the umbilical power cord. The compressor delivers the compressions on the patient's chest. The torso restraint is placed underneath and around the back of the patient to firmly secure the compressor to the patient. The piston action, combined with the torso restraint, provides both sternal displacement and circumferential chest compressions simultaneously. This unique combination produces and contains compression force, which improves hemodynamic efficacy, increasing the success of CPR. The head stabilizer attaches to the torso restraint to provide stability during continuous operation of ROSC-U and positions the head for use of a protected airway when appropriate. ROSC-U is powered by a unique rechargeable lithium iron phosphate battery control unit. The distinctive characteristics of the lithium iron phosphate battery provide a significant increase in the number of charge-discharge cycles compared with other battery types. For example, a fully charged lithium iron phosphate battery will retain 80% of its charge after sitting inactive or being stored for 1 year. We recommend the battery control unit stay inside the provided carrying case at all times, including when the unit is being charged. To charge the battery, insert the charger's AC power cord into any 120-volt AC outlet. Next, remove the charging port cover, if necessary, and plug the charger's round barrel power connector directly into the charging port in the recess on the battery control unit below the main power rocker switch. To protect the charging port from debris and contaminants, the charging port cover should always remain inserted into the charging port when ROSC-U is not being charged. When the charger is connected, the LED on the charger will light up red, indicating that the battery is being charged. When this LED turns green, the battery is fully charged. Fully charging the battery for the very first time, or charging a completely depleted battery, takes approximately 6 hours. Fully charging a partially depleted battery will take significantly less time. A fully charged battery will operate the compressor for approximately 3 hours of use. We recommend that the battery control unit be charged after each use, whenever possible. We suggest you keep the battery control unit constantly charged, as constant charging will not affect this type of battery. Be aware that attempting to charge ROSC-U with a non-approved charger could result in damage to ROSC-U, its battery, or personnel. Charging ROSC-U with a non-approved charger voids the warranty. Remember, to protect the charging port from debris and contaminants, The charging port cover should always remain inserted into the charging port when ROSC-U is not being charged. The umbilical power cord is designed to be permanently attached to the compressor and should not be removed. If the umbilical power cord connector is disconnected from the battery control unit, it is imperative that the connectors are properly aligned before attempting to reconnect them. The control unit and the umbilical power cord have a matching set of alignment keys that assist in connecting the Molex connectors on the control unit and the umbilical power cord. Align the indented mark on the surface of the battery control unit with the black guide mark that appears on the blue ring of the Molex connector on the umbilical power cord. Once the alignment keys have been properly aligned, apply gentle but firm force to insert the umbilical power cord's connector into the control unit. The locking ring on the cord's connector should pass over the 3 retention tangs of the control unit's connector. When the connector is seated firmly, turn the locking ring of the umbilical cord approximately 1/4 turn clockwise until a firm seating can be felt and a dull click is heard. Please note that if you encounter resistance when attempting to make this connection, the alignment keys may not be aligned, or the locking ring may need to be rotated to pass over the retention tangs. Disconnecting is simple. Just rotate the locking ring 1/4 turn counterclockwise and pull to remove. This is useful when switching out battery control units quickly with minimal interruption to CPR. In the next section, we will examine the operation of each control and identify each user-related symbol associated with the operation of the ROSC-U miniature chest compressor.